Hello, I'm Dr. Fiona Tuhewe and welcome to the WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. First, some housekeeping. You can choose the language in which you'd like to hear this press conference by turning to the globe on the bottom right of your Zoom application and selecting the language of your preference. Joining us from Brazzaville, Congo, is Dr. Masidiso Moweti, who is the WHO Regional Director for Africa, and I will now give the floor to Dr. Moweti to introduce our other panelists.
Greetings to all our colleagues in the media and everyone watching online. Our press conference today is, of course, on COVID-19, but also on polio and the World Health Regional Committee for Africa. So this is the annual meeting of ministers of health who come to make policy, reach agreements on what they're going to do to improve health, and most importantly, how they will work together as a region on the health of the population. I'm very pleased to be joined for this conversation by the Honorable Professor Mijiawa Mustafa, the Minister of Health and Public Hygiene and Universal Access to Healthcare of Togo. Bonjour et bienvenue, Monsieur le Ministre. And I welcome the chairperson of but the minister is also the chairperson of the 75th session of the Regional Committee. So he's chairing this meeting of ministers that I mentioned. I also welcome Dr. Jnj Vaccine, the chair of Rotary's National Polio Plus Committee in Nigeria. A warm welcome to you. Rotary is our wonderful partner on polio eradication. Dr. Funcho will update on Nigeria's efforts to end all forms of this virus once and for all. As I said, this week, Africa's health ministers and other health leaders have come together virtually for the 71st session of the WHO Regional Committee for Africa. So this forum, it's a governance forum of WHO, sets regional priorities and strategies to achieve better health for people in African countries. Delegates have agreed on actions in response to immediate challenges such as the fight against COVID-19 and the vaccine rollout. They've also endorsed frameworks on other important health issues, such as cervical cancer, which is among the biggest killers of African women, a framework for integrated action on tuberculosis, HIV, sexually transmitted infections, and hepatitis, which incorporates lessons from the decades-long HIV response. We will hear more about the Regional Committee's deliberations from the chairperson, the Honorable Minister Mijiawa. 1 year ago, almost to the day, we celebrated a monumental milestone when the African region was certified as free from wild polio virus. That achievement was only possible because of decades of work by courageous women and men. Our success in ending wild polio virus in Africa shows what is possible when we work together with urgency and determination. COVID-19 has now threatened this triumph as governments worked hard to limit its spread, and paused some immunization campaigns. However, we cannot waver, and with renewed vigor, we can overcome the final hurdles that jeopardize our success. Since 2018, 23 African countries have experienced outbreaks of vaccine-derived polio. These outbreaks can happen when not enough children have been immunized and poor sanitation exists. During yesterday's special polio event, as part of the Regional Committee, African governments fully recognize that we must not let any form of polio sneak through the cracks in the armor of immunization and take hold again. They committed to ending all forms of polio. We have the know-how, but it must be backed by committed resources to reach all under-vaccinated communities and ensure that all children thrive in a world free of polio. Together, we can help the world achieve polio eradication. Since July 2020, polio vaccination campaigns have stepped up and almost 100 million African children have been reached. Polio staff, systems, and resources are on the ground across the continent, protecting gains against this virus, as well as helping to respond to COVID-19, to Ebola, cholera, and other disease outbreaks. As we keep making progress, it's vital that the polio infrastructure and resources are maintained to serve wider health interests. We are working closely with countries on this, and I'm sure we'll hear more from Dr. Funsho. Turning then to the COVID-19 situation in Africa, the third wave appears to be stabilizing, but cases are still very high, with almost 248,000 reported in the past week. 24 countries are in resurgence, and deaths are rising in 8 countries. This is a preventable tragedy if African countries can get fair access to the vaccines. For months, we've planned with national authorities to accelerate the vaccine rollout as soon as supplies became available. I'm delighted that in the past week, 13 million doses have been administered, triple that of the previous week. Many of these doses are from donations and sharing arrangements through COVAX. I'd like to appreciate the governments that have shared doses with African countries. We're still hopeful that 10% of people in Africa will be vaccinated by the end of September, a very daunting task. 117 million doses are due to arrive in the coming month, and up to 34 million additional doses will be needed to reach that target. So I urge countries with supplies to keep sharing doses. With international solidarity, we can protect those at highest risk of COVID-19 in all countries in the world. I also encourage African governments to ramp up the readiness to utilize these vaccines when they arrive, ensuring that human, material, and financial resources are available to get vaccines into the arms of our populations. No precious dose should be wasted. I look forward very much to our conversation, and thank you once again for having joined us.
Thank you very much, Dr. Moweti. Now to you, Honorable Professor Mijiawa Mustafa. Could you tell us about the African Minister's commitment to defeating all forms of polio?
Merci, Madame, merci, chers frères, chères sœurs. Bienvenue à cette conférence de presse. C'est vrai que, comme l'a dit tout à l'heure le docteur Moweti, il y a un an que la région africaine a été certifiée exempte de poliovirus sauvage. Et c'est vrai que c'est le fruit de nombreuses années de travail et nous avons tous applaudi. Et alors, maintenant, la question qui se pose, c'est que compte tenu du fait qu'on a encore quelques rares foyers de polio sauvage et quelques cas constatés ça et là chez des gens qui ont eu, chez des enfants qui ont été vaccinés par la forme orale, nous avons un impératif, c'est protéger entièrement tous les enfants de toutes les contrées, en se disant que dès qu'il y a un foyer, quel que soit l'endroit où il se situe ce foyer-là, il faut considérer que notre région est soumise encore à cette maladie et que toute flambée doit être considérée comme une urgence de santé publique. Et c'est ce pourquoi, lors de ce comité que le Togo a eu l'honneur, la joie, le bonheur d'abriter, il y a un tableau de bord pour un suivi correct et fiable des indicateurs qui a été abordé. Et il y a eu un engagement de tous les ministres à maintenir la poliomyélite comme une priorité sanitaire en rendant disponible le financement au niveau le plus décentralisé, c'est-à-dire au niveau des districts, et en impliquant tous les acteurs de tous les niveaux dans la campagne de vaccination. Et cet engagement est motivé par la ferme conviction que nous avons de venir à bout de toutes les formes de poliomyélite, qu'elles soient secondaires au virus sauvage ou qu'elles soient imputables à la forme post-vaccinale. Donc, toutes les formes doivent être combattues pour qu'ensemble, nous puissions débarrasser définitivement notre continent avec, bien sûr, le soutien des organisations partenaires et l'engagement ferme de nos États. Voilà schématiquement ce que je peux dire pour ce qui a été retenu par les ministres lors de ce comité régional. Encore une fois que le Togo a été très heureux d'abriter. Je rappelle qu'il y a 2 ans, le Togo a été élu à l'unanimité pour abriter cette session. Et la session devait se dérouler, comme vous le savez, même l'année dernière, sous la forme physique, mais c'est pour des raisons de COVID que nous avons tenu ça de façon virtuelle. Et je remercie sincèrement le directeur général de l'OMS, la représentante, la directrice régionale de l'OMS, et bien évidemment tout le comité d'organisation, tous ceux qui ont contribué à la coordination. Je veux parler notamment de Madame Diallo, qui est la représentante résidente de l'OMS au Togo. Je remercie toutes ces contributions-là et tous ces acteurs en se disant que ceci rentre dans la droite ligne des préoccupations du chef de l'État et du gouvernement du Togo. Et nous nous tenons toujours prêts, une fois traversé la zone de turbulence liée à la COVID, à abriter le comité régional sous la forme physique. Encore une fois, je vous dis merci.
Thank you very much, Honorable Professor Mustafa. And journalists, please remember, you can let us know if you want to ask your questions live, and we'll give you that opportunity. So now over to you, Dr. Tunji Fusho. Could you tell us more about the importance of staying on the course on polio?
Thank you very much. Thank you, members of the press and Honorable Chairman. It's a delightful opportunity to be here today when we just celebrating our 1 year of Africa certification by WHO from the wild polio virus. It's been a very long journey, and we have come a long way from when we started this journey in 1988, when polio was paralyzing 350,000 children daily in 125 countries, to a point now where we have just barely 2 cases so far this year in just 2 countries of Afghanistan and Pakistan. And a lot of effort by all TPI partners have come into this, with all the governments of the world. And since we're talking about Africa, the governments of Africa, with the initiation of President Mandela's Kick Polio Out of Africa initiative that led to massive immunization campaigns, we have seen tremendous improvement. And this has also affected other childhood diseases. So we've gone a long way. We have met our promise 99.9% of the way. 5 regions of WHO are now certified polio free. We're now left with MRO, which is where Pakistan and Afghanistan are located. So it's a long journey. It's a lot of money under the bridge. At the last count, more than $20 billion US. So we cannot, I want to repeat, we cannot, fail to continue the journey and put, at the disposal of the program, all the resources that are required to get, to this goal. The financial requirements are humongous. The budget for this year is put about $1 billion, and the recent quite new early models of projections of cost to the end of our polio eradication strategy comes to about $5 billion US. It's early days yet. That is still going to be fine-tuned. So we cannot afford not to bring these resources to bear. And I want to appeal to governments, particularly governments in Africa, to continue to support this program, increase funding for primary health care, so that all immunizations, but particularly in our case, polio immunizations, not only continue, but are ramped up to ensure that we have quality immunization. I think at this point, one must give gratitude to governments, across the world, principally United States, Canada, European Union, Germany, Japan, amongst others, and the UAE, who have continued to support us. But we want to appeal to African governments to gradually take over this program financially, and also from the point of view of providing other human and material resources. We'll continue to innovate to ensure that we have good quality immunization programs. The rapid response team, particularly in view of the ravaging circulating vaccine-derived polio virus, which is affecting about 11 countries in Africa, so far, needs innovations that will ensure that our outbreak responses are of good quality. And this cannot happen if we're not on site. Immediately this happens. And that is why the rapid response team, comprising 20 professionals from our partnership, on ground spot on, so that in case of any outbreak, they're there within 72 hours to ensure that the initial response is robust. First of all, to localize the infection, and secondly, to mount the appropriate responses. In order to ensure good quality immunization rounds as well, we need to mobilize, our field workers, and payments are one of those to make them happy. Now we piloting the mobile money transfer, which will ensure that immunizers or vaccinators get their funds, directly from source rather than through any third party. So we are getting there. We need to continue keeping our hands on the plow and provide the resources that are necessary for us, to breast the tape and ensure that no child is ever paralyzed by the wild polio virus. Thank you.
Thank you, Dr. Funsho, and indeed, thanks again for that pledge. Now that we've heard from all our panelists, it's your turn to ask your questions, our journalists, and to do this, please use the question and answer function on the Zoom application. Please also remember you will need to provide a name and the news agency you represent to have your question answered. And we would really ask that you ask one question at a time. We also have on hand Dr. Richard Mihigo, the Region Advisor for Vaccine Preventable Diseases for WHO, and Dr. Tieno Balde, the Deputy Incident Manager for the COVID-19 response in the WHO African region. We also have Dr. Pascal Mukanda, the Coordinator for the Polio Eradication Program, and they will be right on hand to answer your questions too. So our very first question comes from Emery Makumano from BBC, and the first question goes to you, Dr. Moeti. What are the main challenges for better health in the continent for the coming years? And I will also give another question still from BBC to you, Honorable Professor Mustafa. What can we take away as the biggest achievements of this 71st Regional Committee that is closing? Over to you, Dr. Moeti.
Yes, thank you for that question, which was really central to the discussions of the Regional Committee, as the Minister will share with us. Well, obviously, overcoming the COVID-19 and being able to continue working on health more broadly on other important health problems and health priorities in the region is one of the biggest challenges facing countries today. But over and above that, African countries have been working with WHO and other partners over the years to improve access to essential services for their populations, and of course, to be able to prevent disease and to be able to address the determinants of disease working with multiple sectors. So one of the biggest challenges countries are facing is financing for health, not only having sufficient resources to invest in health, but also finding the best strategies for investing in health so that we get the best results, so getting value for money of the investments. And countries have worked very hard on this. So within that financing of health then arise other challenges of the capacity of national health systems in our region. We know that there are challenges with human resources. Africa is one of the regions facing the biggest gaps in having sufficient numbers of nurses, doctors, paramedics, people particularly working at the primary level to make sure that people are in contact with good quality health services close to where they live, and then have access to a referral service at the hospital when they need it. Another challenge in our countries is access to infrastructure, not only central hospitals in the capital cities. But again, health infrastructure, primary care centers, health posts with nurses or doctors with the basic skills that are needed at the peripheral level. There are big differences between access to health services in rural and urban areas. So the governments are facing the challenge of really expanding access to a basic package of healthcare services of good quality, as I said, very importantly on issues of prevention, but also of ensuring that people get access to treatment when they need it. Having access to data, it's very important to have information so that you know what is happening, you know what you are delivering, you know what are the gaps, and you know what is the progress that you are making. So having strong, robust systems that are able to monitor health progress, health diseases, carry out surveillance are some of the challenges that Africa faces. I would say that despite these challenges, what we are seeing, which is extremely exciting, especially during in the context of the COVID-19 pandemic, is a real determination and commitment by African leaders, starting with the heads of state, very much the ministers of health with whom we have been in discussion in the last couple of days, and their partners to work to improve health in Africa. There is a strong collective will also to work together across boundaries in countries, both on communicable diseases like COVID-19, polio, Ebola, and others, and also on sharing resources, sharing ideas, working in the sub-regions of Africa, and basically exchanging experiences as well to share innovations of what has happened in Africa. So I would say in conclusion, there is a strong will to overcome some of the biggest problems. Financing is key. And I think that after the impacts of the COVID-19 pandemic on African economies, we will all need to do our best to continue to advocate for health financing to be sustained so that we don't lose the gains that we have made over the years.
Thank you, Dr. Moweti, and now to you, Honorable Professor Mustafa.
Merci. Lors de nos séances de travail pour le comité, la 711e session du comité régional, et comme l'a dit tout à l'heure le docteur Moweti, l'un des plats de résistance a consisté à la COVID-19. Tout le monde sait que depuis bientôt 2 ans, c'est cette pandémie qui préoccupe beaucoup tous les pays. Et dès le départ, il se posait la question du diagnostic, il se posait la question de la prévention. Vous vous souvenez des mesures barrières qu'on a édictées dans nos différents pays. Et on sait aujourd'hui que ces mesures barrières qui sont indispensables dans la lutte et sont difficilement respectées de façon homogène dans toutes nos contrées. Et on sait aussi l'allure que l'épidémie a prise avec des hauts et des bas. Et nous sommes dans certains pays à la 3e vague, dans d'autres à la 4e vague. Et il se pose bien évidemment la question de la vaccination que nous avons commencé depuis quelques mois avec la question de la disponibilité, la question de l'approvisionnement. Vous vous souvenez que la plupart de nos pays ont adhéré à l'initiative COVAX et compte tenu du fait que l'Afrique devrait s'assurer un approvisionnement, une production de qualité, les chefs d'État ont mis en place l'initiative AVAT. Et par exemple, nous sommes heureux au Togo d'être le tout premier pays africain à avoir reçu le 5 août dernier les premières doses de vaccin Johnson & Johnson fabriquées en Afrique du Sud. Et donc, il y a un certain nombre de problèmes liés à la vaccination. Durant toute la session, on a eu à venir dessus le problème de l'infodémie, compte tenu du fait que les gens sont très sensibles à ce qui circule sur les réseaux sociaux et ceci n'a pas du tout facilité la tâche des acteurs que nous sommes dans la mise en œuvre de la vaccination. Alors, quand on prend la COVID telle qu'elle se présente et qu'est-ce qui a été fait, par exemple, dans un pays comme le Togo, c'est qu'on a mis en place des organes, et le comité de crise présidé par le chef de l'État tout à l'heure le docteur Meti faisait état du fait que les dirigeants africains ont pris à bras le corps cette question. Donc, au Togo, il y a le comité de crise qui est présidé par le chef de l'État. Il a été mis en place un comité de gestion et il a été mis en place un conseil scientifique pour donner des avis au gouvernement. Et il a été mis en place également une coordination nationale compte tenu du fait que la maladie est tentaculaire. À côté de ces organes, la COVID a induit un renforcement du système de santé puisque nous avons mis en place des entités dédiées à la prise en charge des malades et nous avons également procédé aux mesures d'accompagnement, c'est-à-dire que, outre le système de santé qui a été renforcé par des outils de diagnostic, par des outils de traitement, et ici je salue l'apport des partenaires, notamment l'Organisation mondiale de la santé, l'Union européenne, l'UNICEF et toutes les entités qui nous ont appuyés. Et je profite de cette occasion pour leur dire merci. Et bien évidemment, depuis quelques mois, depuis le mois de mars, nous avons lancé la vaccination. Et cette vaccination, aujourd'hui, nous avons eu à utiliser de l'AstraZeneca avec 416 000 doses qui ont été mises à notre disposition. Et nous avons aujourd'hui 146 000 personnes qui ont eu les 2 doses d'AstraZeneca. Il y a 123 000 personnes qu'on est en train de vacciner avec du Pfizer à partir d'aujourd'hui même. Et nous avons eu à disposition 400 000 doses de Sinovac et nous avons commencé par administrer ce vaccin aux populations estudiantines. Et aujourd'hui, on a 27 000 personnes qui ont eu la première dose et 11 000 qui ont eu les 2 doses de Sinovac. Et nous avons à disposition à peu près 300 000 doses du vaccin Pfizer et nous avons déjà vacciné 48 000 personnes qui ont eu la première dose et 28 000 qui sont en train d'avoir la deuxième dose. Alors, tout à l'heure, je parlais du 5 août où nous avons eu du Johnson & Johnson, 117 000 doses et déjà, nous avons 30 000 personnes qui ont eu ce vaccin Johnson & Johnson. Alors, tout à l'heure, la représentante, la directrice régionale de l'OMS faisait état de la nécessité d'une action conjuguée, harmonisée entre les pays. Nous vivons cette réalité-là parce que, par exemple, la fermeture des frontières n'est efficace que lorsqu'elle est partagée, lorsque nous aurons des attitudes totalement harmonisées entre pays. Et tout à l'heure aussi, il y a la nécessité de l'accès aux soins dont on a fait cas lors du comité régional, l'accès aux soins au plus grand nombre. Et au Togo, cette préoccupation a conduit à ériger un ministère délégué chargé de l'accès universel aux soins. Bien évidemment, on a fait attention en évitant que la COVID n'occupe toute la place et laisse de côté les autres maladies infectieuses parce qu'on a constaté que ça a impacté même les autres vaccinations et c'est ce qui fait qu'avec l'appui des partenaires, nous sommes en train de faire des séances de rattrapage pour que nous n'ayons pas des enfants non vaccinés. Alors, le comité régional a abordé aussi un certain nombre de questions, les autres maladies infectieuses que sont la tuberculose, le VIH-Sida, les méningites, les hépatites virales, qui sont un réel problème de santé publique. Et bien évidemment, comme je l'ai dit tout à l'heure, il y a eu un appel qui a été lancé en vue de l'éradication de la polio. Le cancer du col de l'utérus, dont on sait que c'est l'un des plus fréquents, et bien évidemment, on sait ses liens avec le papillomavirus. Et maintenant, la démarche est en train d'être menée pour que la vaccination contre ce virus appartienne dans les toutes prochaines années au programme élargi de vaccination. Bien évidemment, il y a toujours eu l'épineuse question du financement et du budget. Et ça, c'est un problème récurrent. Et tous nos États s'engagent petit à petit à aller dans ce sens-là. Sans oublier, bien sûr, la recherche avec la nécessité d'arrimer l'université au ministère de la Santé publique. Donc voilà, de façon ramassée, les différents points qui ont été abordés en sachant que la COVID-19 reste une préoccupation, mais les autres maladies aussi ne sont pas oubliées. Merci.
Thank you very much, Honorable Professor Mustafa, for that very elaborate answer. Now, over to you, Elizabeth Pearson from Figaro, to go live with your question.
Bonjour, merci beaucoup. Donc je suis Elisabeth Pierson, journaliste au Figaro, le quotidien français. Je voulais savoir, c'est à l'adresse de tous les panélistes, concernant le virus Ebola, dont on n'a pas encore parlé. Est-ce que la lutte contre la pandémie du Covid-19 accapare tous les efforts et est-ce que ce ne serait pas au détriment justement de la lutte contre Ebola? On voit la résurgence notamment en Côte d'Ivoire avec une 50aine de cas. Est-ce que c'est inquiétant, cette résurgence? Qu'est-ce qui est mis en œuvre actuellement? Et voilà.
Okay, thank you very much, Elizabeth. Over to you, Dr. Moeti.
Thank you very much. I think the experience that we've had, particularly in Guinea, which has had cases of Ebola, of managing at the same time the continuation of the response to COVID-19 and also then responding to Ebola, encourages us that, of course, it's very challenging to have to deal with several outbreaks at the same time, especially if one is this very threatening COVID-19 pandemic. But we've seen that it has been possible to, I guess, use previous experience, the capacities that have been built up in some of the countries over several outbreaks, and to use those strategies together in a way, in such a way that it has not really had such a negative impact on, say, the Ebola outbreak in Guinea. So the preparedness, one of the advantages that we saw at the beginning of the COVID-19 pandemic in Africa generally was that we were in a state of preparedness in many countries around what was then going on with the Ebola outbreak in the Democratic Republic of the Congo. So the countries were very soon able to switch some of this preparedness and address it to COVID-19. And then in the same way, some of the things that are being done for COVID-19. So what is it that you do with a pandemic? We've learned that outbreaks, epidemics start at the community level. So the strategy of addressing people, again, in relation to Ebola, reaching out to the community, reaching out through the networks, letting people know that there is this risk and informing people what needs to be done. So that was soon then diversified into the Ebola outbreak. And some of the capacities that had been built for doing contact tracing, the laboratory capacities, etc., the vaccination capacity, of course, which had been built up before, can be deployed. One of the topics that came up in the regional committee by one of the ministers was the fact that we need to learn to work in an integrated way on these multiple health challenges that countries are facing. So all the systems, the public health institutes that have been set up, the training of healthcare workers, the use of infection prevention and control materials, with really strategic planning, can be deployed from the COVID into an Ebola outbreak, understanding that, of course, additional resources almost need to be injected so that the capacities are sufficient to deal with one and the other. It's challenging, but I believe that having to confront multiple problems at the same time is teaching us a lot about what we can integrate of the interventions, strategies, and capacities, and what has to be then added on separately because the diseases are not identical.
Thank you, Dr. Moeti. So now over to you, Lisa Schlein from Voice of America, to go live with your question.
Yes, hi. Thank you. Nice to see you. My question is for both Dr. Moeti and Dr. Kuncho, please. I'd like to know in what ways COVID-19 is threatening the resurgence of polio in Africa, and whether the measures that you are taking in order to stop the spread of polio, both in Nigeria and beyond. And lastly, are you able to conduct polio immunization campaigns safely during this pandemic? Thank you.
Okay, thank you, Lisa. Over to you, Dr. Moeti.
Yes, clearly the COVID-19, as I said, is demanding in terms of the capacities that countries have to address multiple needs. So to be frank, at the start of the pandemic, when the lockdowns were in place, when there was the early response was being implemented in countries, people were being trained and deployed to deal with COVID-19. The polio campaigns that had been planned in the earlier part of the year were stopped, were postponed. We worked very hard. We had discussions with the ministers of countries where we have this the so-called vaccine-derived polio virus, 23 countries. We helped them working with partners like UNICEF, Rotary, and others, the Bill and Melinda Gates Foundation supporting to do their planning. And they've been able to see how to plan campaigns to address the polio outbreaks, because now we're dealing with outbreaks. It's no longer that wild polio virus. So we're dealing with polio outbreaks. So it is possible to work and restart the polio response activities. And in fact, we were poised. We had done a lot of planning with the countries. We were poised to implement in more than 23 countries simultaneously outbreak response campaigns. And we've had a challenge with availability of the new vaccine that was supposed to be used. It is very demanding. It really demands that, as I said, in response to the previous question, that you plan to do both. You have to continue to deal with COVID-19, and it's very much now going to be vaccines becoming available in this quarter at the same time as some countries are going to be carrying out polio campaigns. So the very detailed micro planning of exactly where, how, with what in terms of resources, people to carry out the vaccinations, money, storage, and there's been a lot of work done also to support access to cold chain capacity in countries to make sure that it's sufficient to deal with both the COVID-19 and the polio campaign needs. And so all of that needs meticulous planning, mobilization, huge mobilization of the capacities, especially people on the ground, people to carry out the planning, the logistics capacities, the financial resources to do all of this work. It is a challenge, but my sense is that the countries were up to it, and these campaigns are going to be run when the vaccine becomes available. So over to Dr. Funsho.
Dr. Funsho, you have the floor.
Yes. Thank you very much, Dr. Moeti. There's no doubt that at the beginning of the pandemic, when everyone was trying to find his way, even for COVID-19, there was a pause in campaigns. First, in order to protect the vaccinators, and secondly, in order to prevent, the spread of COVID-19. But since we resumed in July, particularly in Nigeria, we've had, so far about 6, campaigns. 4 of those were directed at the circulating vaccine-derived, polio virus, and the other 2 were using, bivalent vaccines, to cover areas that are overdue for campaigns. So that slowdown did affect, the resurgence of circulating vaccine-derived, and that is why we have quite a number of states in Nigeria now that we're finding circulating vaccine-derived, polio cases, paralyzing children, and in a few cases in environmental samples. Be that as it may, as Dr. Moeti mentioned, the new vaccine has come in very handy. We have learned, to ensure that we have vaccine accountability, so that if we have excess, in one part, of the country, we move it, to another part of the country where there's shortage and so on. So that is working very well, really. We're able to conduct campaigns. We just ensure that the health workers, where possible, are immunized in the first 2 campaigns that we have mounted in Nigeria, that they're given priority, and of course that they also observe non-pharmaceutical preventive measures. They wear their masks. They are provided with masks and hand sanitizers to ensure that they protect themselves and also protect the families that they are trying to immunize. The other aspect of this, of course, is that health resources were moved from primary healthcare centers to assist with the COVID-19 campaign. So that has reduced the numbers of health workers available to do primary healthcare and also give routine immunization, including the polio vaccine. But gradually, as we're getting used to having the COVID-19 around, we are adjusting to ensure that primary healthcare services, particularly immunization, continues. And then we have these outbreak responses that are being carried out across the country. We had one that ended just on Tuesday, as I speak, in Nigeria, starting from Saturday to Tuesday, 4 days.
Excellent. Great to know that all the multiple priorities are being taken care of. I'll hand over the floor now to you, Sarah Jerving from DEVEX, to ask your question.
Thank you. So WHO has asked countries to conduct self-assessment reports on their COVID-19 vaccine rollout preparedness. How many countries have submitted their self-assessment reports to WHO, and how many countries have not yet submitted their self-assessments? And are you concerned that some countries don't have detailed vaccination plans at the national and district level, and what would be the implications of that? Thank you.
Great. So Dr. Mihigo, I hand over this question to you.
Yeah, thank you. Thank you very much, Fiona, and for the question. Yeah, I think we, first of all, let me say that most of the country in the region, before to start the vaccination drive, developed strategic plans that we have called National Deployment and Vaccination Plans, which was really a major step moving forward in receiving the vaccine. And the second phase was really to operationalize these plans up to the really district level, community level, to have micro plans that will help really to reach individual in the even remote community. So as you have said, we have recommended country after the first phase of rollout of the vaccine to conduct self-assessment or interaction review to make sure that their plans really match the reality on the ground. And it's very encouraging to see that many countries have embarked on this. I don't have the exact number of countries, but I think we have many countries that have done, and we can send you those numbers. What is good is that we, from the preliminary report that we have seen from those countries, countries are making adjustments to their micro plan, to their local plan, to try to understand where were the bottlenecks, and more importantly, to really anticipate this surge capacity that now is coming in terms of the vaccine, to be able to deliver the vaccine efficiently. So we are not yet perfect at the point where we would like to be, but I think there are a lot of effort that country has been doing, and we'll be more than happy to update you regularly on all the effort that country are doing to make sure that the vaccines are actually being delivered to the people who really need them. Thank you.
Thank you, Dr. Mihigo. I now come to you, Dr. Balde, with Ebola questions, 2 of them. One is from Katarina from Bloomberg. Do you have any information about the suspected Ebola case in Burkina Faso? Any idea when results are expected? Then we have another question from EFE News Agency. We would like to confirm with official sources the recovery of the Ebola patient in Ivory Coast. We would like to know if WHO can confirm her recovery. Over to you, Dr. Balde.
Thank you, Dr. Fiona, for the question. Indeed, the World Health Organization Office of Burkina Faso were informed about a few days ago about suspected cases of Ebola in Ouagadougou. And we know that some investigations are currently ongoing, and the sample has been taken. and they has been sent to a reference laboratory in Dakar, notably in IP Dakar, Institut Pasteur of Dakar. So the investigation are currently ongoing, and obviously wherever this type of situation happen, the World Health Organization try to mobilize all of the different resources and all of the attention, as we did recently both in Guinea but also in Côte d'Ivoire, for really providing all of the necessary support at the beginning of the signal, because this is for the time being a signal which has not been yet confirmed. So we are still waiting for more information from the national health authorities, but we are following and monitoring the situation very, very closely. About the situation in Côte d'Ivoire, maybe I might start, and probably Dr. Moiti might be able also to elaborate. It's important to note that we have been, really in close contact with the health authorities in Côte d'Ivoire about the cases which has been confirmed some weeks ago now. And apparently the patient is doing good. Some tests has been conducted. Two tests has been conducted recently, one on the 21st and also on the 23rd of August, which seems to be negative. But yes, we are really interacting with the national health authorities there to be able, to really provide all of the necessary support, again, for getting, that person, recovering, to recover, but also to take all of the necessary measures, to contain this outbreak there. Thank you. And
thank you very much, Dr. Balde. Daniel from CGTN, would you want to go live and ask your question? Daniel from CGTN.
Yes, can you hear me?
Yes, we can hear you. Kindly go ahead.
Yes, thank you. My question goes out to Dr. Moit. Dr. Moit, how worrying is the news that vaccine fades after 6 months? And could there be need for boosters, especially in Africa?
Okay, we are still looking at the issue of boosters, and WHO is still looking at the data to see, the degree to which the level of immunity reduces after vaccination, and whether there really is evidence showing that there is a need for booster doses. So there is some evidence that there is some decrease. We are not sure that this is a decrease that would make such a difference that it would be necessary to provide booster doses. I think it's very difficult for us to talk about booster doses in Africa. We have not covered even 5% of the population yet with the initial vaccinations that are needed to slow down the spread of the virus, and most importantly, stop what we think might be a fourth wave, which is coming. We're in a third wave now, which looks like it's leveling off, and to reduce the numbers of seriously ill people and people who are dying of COVID-19. So I would say that for Africa, this is what we are striving for at the moment. As I said in my opening statement, we're expecting the delivery, access to vaccines to start to move now, to start to increase in the last part of the year and also next year. And our wish is to have these vaccines used to immunize as many of the people who are needing their first doses of vaccine, the second doses of vaccine as possible. And as we observe the matter of booster doses being decided upon in other countries, we are urging that these then don't constitute an additional risk of delay in access to vaccines to vaccinate the African population at the level that's needed to have an impact initially on the outcome and particularly on deaths due to COVID-19. But as WHO, we're still studying the data to understand better and to see how to advise and guide our member states at the global level to achieve what we have been striving for all along, that all countries have equal to the vaccines, that we influence the situation all over the world, and that we try to have an impact on the inequity, which is currently such a strong feature of the response to the global pandemic.
Thank you. And talking of vaccine doses, we have a question from Mani de Bruin of Daily NRC in the Netherlands. And so to you, Dr. Mihigo, I'm going to give this to you. And it says, how many COVID-19 vaccines are now made in Africa, and how important is it that the vaccines are made in the continent itself? Also, the mentioned vaccines from J&J in South Africa, are they completely made in South Africa or just put together out of imported J&J elements and packaged in South Africa?
Yeah, thank you, Fiona. Well, I think as we have heard from the Minister of Health, Honorable Minister of Health from Togo, Togo was the first country to receive the Jnj vaccine that is currently being produced in South Africa. This is really a major step forward to have vaccines that are now being produced on the African continent. It's for the moment mainly a fill and finish facility, but as you know, WHO is working with not only South Africa but many other countries to increase the tech transfer technology so that there can be more countries that can produce a vaccine on the African continent. There are a lot of discussion going on in South Africa to have a second site of production there, in Senegal, but also in Rwanda, where there is an advanced negotiation. So we do hope that in the coming few months, we will see more vaccine being produced on the African continent. But in terms of number of doses, as they've been said, the number has started to increase in terms of vaccine that are coming to the African continent. We've already around 130 million doses that have been so far distributed across the region. But again, this is a relatively very low number, and we hope that a combination of not only the donation, as we have heard from Dr. Moeti, but also those coming through COVAX, and more vaccines that are going to be produced on the African continent is going to change the dynamic in terms of the supply coming to the region. Thank you.
Thank you, Dr. Mihigo. So, Benjamin Ahenda, would you like to go live with your question? Benjamin Ahenda. All right, I'll move on now. Okay,
hello.
Benjamin. Yes, go ahead, Benjamin.
No, thank you. I had only one question, yeah? And this is on vaccine. We have had cases whereby, patients in Kenya are having 2 doses of AstraZeneca, and the efficacy of this kind of 2 doses tends to be a bit weak. They are calling on for a 3rd jab. To the extent some of us or some of the patients are now preferring to have maybe Moderna or JJ. What can the WHO tell the Kenyan people about this?
Okay, Dr. Moeti, you'd already spoken about booster shots. You want to add something?
Yes, I think we must give people the right information that it's not true that the AstraZeneca efficacy is weak. So perhaps from the data when the trials were being done, certainly the efficacy of the Pfizer vaccine was found to be in the 90s. The efficacy of the AstraZeneca was found, I think at the first dose, to be in the 70s, something like this. But certainly after 2 doses, the AstraZeneca is an extremely efficacious vaccine, not in stopping somebody getting infected. I think everybody needs to know, even when you've had the Pfizer vaccine, the chances are you could get infected. What all these vaccines prevent is severe disease and dying. I think we've seen many of the clinicians who are treating patients indicating that when now in countries where the vaccination rates are high, there are still cases among young people who are not wearing masks, who may not have been vaccinated, but what they're not seeing is seriously ill patients needing intensive care and people dying who have been vaccinated. In high coverage vaccination sites, what they are seeing is that all the people virtually who are dying now are people who are unvaccinated. People who've been vaccinated, be with AstraZeneca, which has been widely used in the United Kingdom, for example, be with the other vaccines, are not getting severe disease and are not dying. So this is perhaps a correction of the impression among people in Kenya, the reassurance that AstraZeneca is a good vaccine. They should go ahead, get their first dose and get their second dose. And of course, we are looking for every vaccine for our countries that they can get. And we see that countries are getting a variety of vaccines, but we advise people to follow the vaccine that they started with and to minimize also the mixing of vaccines.
Thank you for that clarification, Dr. Moeti, and I'm coming to you, Honorable Professor Mustafa from Togo, still with a question. You could add on to what Dr. Moeti has mentioned, but also with a question from Alphonse Logo from Sputnik Afrique in Togo that says, are African countries sufficiently prepared technically and technologically to face new epidemics should they occur?
Merci. Je voudrais ajouter quelques mots à ce qu'a dit tout à l'heure le docteur Moeti. Ce que nous on observe, c'est que depuis quelques semaines, les décès que nous observons chez les patients infectés du COVID-19, ces décès surviennent surtout chez des non-vaccinés. Parce que lorsque la pandémie avait commencé, on constatait que c'est surtout des gens de plus de 50 ans avec comorbidité, hypertension artérielle, diabète, cancer, tuberculose, insuffisance rénale. Ça, c'était ce qu'on peut appeler la première phase. Mais la deuxième phase, aujourd'hui, que nous observons, les cas graves admis dans nos centres de prise en charge sont surtout chez des gens non vaccinés. Et parmi les 4/5 de décès, on observe des non-vaccinés et des gens parfois de moins de 50 ans. Donc, nous, par ces éléments-là, nous disons que les vaccins que nous avons utilisés sont efficaces, en sachant que nous avons d'abord utilisé l'AstraZeneca. C'est maintenant que nous sommes en train d'utiliser le Pfizer et le Johnson & Johnson, de même que le Sinovac. Un autre aspect que je voudrais ajouter, c'est dire que nous, en Afrique, nous avons quand même un système vaccinal à travers le programme élargi de vaccination qui était un système existant. Si bien que lorsqu'il s'est agi d'utiliser le vaccin contre la COVID, nous nous sommes appuyés sur toute la chaîne de vaccination déjà en place. De la même façon, nous avons tiré le leçon des anciennes épidémies, notamment Ebola. C'est vrai que le Togo n'a pas connu de cas Ebola il y a quelques années, mais on avait mis en place tout un système de prévention. Donc aujourd'hui, il s'est agi surtout de réactiver et de renforcer ce système-là. C'est ce qui fait que dès lors qu'on avait appris qu'il y avait un cas d'Ebola apparu en Guinée, on a réactivé tout le système au point de surveillance, au niveau de la communication et au niveau de la formation à nouveau des différents acteurs. C'est ce que je voudrais ajouter à ce qu'a dit le docteur Moeti tout à l'heure. Merci.
Thank you very much. So it actually also shows that we are ready for the pandemics that could come in, any epidemics and outbreaks or pandemic in that case. So we are coming to the end of this virtual press conference. Now let's turn to our three panelists and hear any final messages. You've got a minute each, and I'll start with you, Dr. Fungi Funsho, to give us your parting shot.
Thank you very much. I would just want to conclude on the note, that we can see the light at the end of the tunnel. Polio eradication is in sight, but we need to continue doing what we're doing in Africa in particular. Governments need to put more resources in ensuring that we improve our primary healthcare facilities and have very good quality outbreak response, in particular, to ensure that the circulating vaccine-derived polio virus is capped and is not allowed to research in any other African country that already, has not seen the circulating vaccine-derived poliovirus. I thank you all very much for being here with us, press people and the chairman. Thank you very much.
Thank you very much, Dr. Funsho. And now to you, Honorable Professor Mijiawa Mustafa, for your last words.
D'abord, je voudrais dire un grand merci aux différents partenaires, que ce soit ceux du système des Nations Unies ou dans le cadre de la coopération bilatérale ou multilatérale dans la lutte que nous menons contre les différentes maladies, notamment la COVID-19. Et je voudrais dire aussi que dans la plupart de nos pays, il y a un engagement extraordinaire des plus hautes autorités, en sachant qu'une lutte comme celle-là n'est possible que lorsque c'est pris à bras le corps par les plus hautes autorités. Et nous, au Togo, nous saluons à sa juste valeur l'engagement du chef de l'État et de tous les membres du gouvernement. Et compte tenu du fait que dès le départ, on se rend compte que ces maladies, ces épidémies, que ce soit Ebola, que ce soit la COVID-19 ou les autres, ça nécessite une approche plurielle, compte tenu du fait que c'est tentaculaire. Donc, tous les acteurs sont mobilisés. Je vous donne par exemple le cas de lorsqu'il fallait faire appel au respect des mesures barrières. Il a été mis en place au Togo ce qu'on a appelé la force anti-pandémie, qui nous a beaucoup aidés lorsqu'il s'est agi de faire le bouclage, lorsqu'il s'est agi d'appeler la population au respect des mesures barrières. De la même façon, les leaders communautaires ont été impliqués, les chefs traditionnels, les chefs religieux, les chefs de canton, via la communication de proximité, avec des radios de proximité qui ont été mises en place et des tournées qui souvent effectuées avec tous les organes, notamment les médias, qui ont été d'un apport très important dans cette lutte-là. Et ça confirme encore une fois le fait que la santé est un domaine très vaste, c'est un domaine pluriel, et que la lutte contre un problème de santé d'envergure comme les épidémies nécessite l'apport, la collaboration de tous. Et nous disons encore une fois merci à tous ceux qui nous ont aidés dans cette approche plurielle des différentes épidémies que nous connaissons. Merci.
Thank you very much. And lastly, but not least, to you, Dr. Moeti.
Thank you, Fiona. I first like to thank very sincerely my fellow panelists, the Honorable Minister and Chair of our Regional Committee, and Dr. Funsho, and just say that in the presence of these two panelists, we have really two key partners in Partnership for Health. I'd like to echo the Minister's strong recognition of the importance of partnership. So the Rotary, which has been such a key player in mobilizing resources, in mobilizing communities, in advocating with governments, playing such a critical role, and we are progressing with polio. And of course, through the Minister, also appreciate the hard work that African Ministers of Health have done in the last year and a half since the start of the pandemic, and the fact that they are working to address other health problems at the same time as dealing with this pandemic, making strong connections with the heads of state. So I also echo the fact that this political commitment and leadership is absolutely critical, because it's the way in which ministers of finance, ministers of health, other ministers that deal with some of the factors that strongly affect health, water and sanitation, education, security, and so on, energy, connectivity. All of this needs to work together to make health better. But finally, just end by saying we recognize most importantly the role of people at the community level, the role of men, women, and children in dealing with everything. As parents taking children to be vaccinated against polio, as individuals deciding to take their own action to prevent the spread of COVID-19, and to advocate with governments as well for the work that needs to be done. So I think that if we put all of this together, as we are working very hard to do, as the ministers are playing a key role to do, I'm confident that as the vaccines start to land, we're going to make progress against COVID-19 at the same time as working on the multiple health health problems that have been discussed by health ministers during this regional committee meeting. And thank you. The journalists play a very important role as well in informing the public of everything that's going on.
Thank you very much, all our panelists, and again to the journalists that joined us today. We've come to the end of this press briefing, and do have yourselves a great day and a great weekend ahead.
Thank you. Thank you.
Thank you.